Obviously, providers need to get paid by the different health insurers that are out there. And shockingly, a fair amount of that still happens with paper checks, particularly in dentistry. While there's a lot of electronic or digital ways those payments can flow. So virtual credit cards is one of them. And how that works is the payer provides to the provider a virtual credit card, and that credit card can contain payment for many patients, and with every patient, multiple procedures. The provider goes and looks to see if they have one of those cards available and keys it in, and that payment is available next day. So one benefit to the provider is they get that funding more quickly. What straight through processing does is it automatically catches that card and processes that. So the provider doesn't have to think about going and looking for the payment, saves the time of keying that in. So that's the first bit of value. Now, when I mentioned the transaction could have multiple patients, multiple procedures, payers provide a different set of information. Different payers provide a different set of information. And what we've done is make a standardized explanation of payment. So when the provider goes into Practice Management Bridge and looks at the transaction, we've broken it down so you can easily see what patients you were paid for and what services. So that's the second bit of value there, is making that standard. And then the final bit of value is with one click of a button, you can post that information back to the PMS. So that's a massive labor savings for the practice. So really trying to make it easy and provide more value to the practices by taking that digital form of payment.